Good evening everyone, this is Dr. Praveen Selvam from ECG BnB. Today we shall discuss about the assignment 2 which is given in Swayam Nptel Ecg course portal. As usual, they have given 10 multiple choice questions. We are supposed to submit our assignment within 10th of August. So which means that we have 2 more days. The first question is, ischemic heart disease occurs typically when there is an imbalance between myocardial oxygen supply and demand. Is this true or false? The above sentence is perfectly true because whenever the oxygen demand increases or oxygen supply decreases, there exists an imbalance between demand and supply. This demand and supply mismatch is one of the most common causes for an ischemic heart disease. So the above statement is true. The next question, which is the most powerful vasoconstrictor secreted by the endothelial cells? You can easily crack this question by linking these two. It is so obvious, yet we will see the explanations. Endothelin is a vasoconstrictor. Adenosine is a vasodilator. Prostacyclin is a vasodilator, and nitric oxide is a vasodilator. Nitric oxide is synthesized by nitric oxide synthase enzyme from amino acids. Prostacyclin is produced in the lungs. Adenosine is produced from ATP. So, among this, endothelin is the only vasoconstrictor present, and it is the most powerful vasoconstrictor which is secreted by the endothelial cells. We will go on to the next question. The most common site of myocardial infarction is anterolateral wall. This has to be noted. The incidence of MI in the anterolateral wall is higher when compared to the inferior wall or posterior wall or interventricular septum. The commonest cause of myocardial infarction is due to, it is not due to vasospasm of drugs, it is not due to coronary embolism or not due to anemia. It is due to coronary atherosclerosis with the rupture of atheromatous plaque. This can be cracked even by a second year medical student. The phase of action potential of the ventricular muscle that coincides with the QRS complex of the electrocardiogram is. For this, you should know certain basic about the ventricular muscle action potential graph. So, when we consider this to be the baseline, the phase 0 is the depolarization wave. So, this is the phase 0, this is depolarization. Okay. Next is the phase 1, which is early repolarization. Next is the phase 2, which is the plateau phase. And the last one is the repolarization phase. Okay, this is the phase 3. So, the phase 0 is the depolarization phase, phase 1 is the early repolarization, phase 2 is the plateau phase, and phase 3 is the repolarization phase. Okay. So, now we have to know what phase belongs to or depicted as what wave. So, phase 0, which is the depolarization wave, is depicted as the QRS complex. So, here comes the QRS complex. This is phase 0, which is the depolarization of the wave, and you know that QRS complex are produced due to the depolarization of the ventricles. And the plateau phase corresponds with the ST segment. So, ST segment, you all know very well that it begins at the end of the S wave, which is here, to the beginning of the T wave. Let me draw a T wave here. So, ST segment will start from the end of the S wave here and beginning of T wave here. So, this is the ST segment, and this ST segment correlates with the plateau phase, and the T wave correlates with the repolarization. So, which phase coincides with the QRS complex? It is the phase 0. The electrocardiogram associated with accelerated conduction of impulses in the conducting system of the heart shows. You all know very well that PR segment is the time taken by the impulses produced from the sinus node to reach the AV node. So, in the case of a tachycardia, which is nothing but accelerated conduction of the impulses, a lot of impulses which will be produced. As a result, the PR interval will get shortened. A patient in the coronary care unit develops episodes of paroxysmal AV nodal reentrant tachycardia. What drug would be generally considered first line for promptly stopping this arrhythmia? So, all those people who work in ICU, this is a very simple question. If you get a AV-NRT, which is AV nodal reentrant tachycardia, the drug of choice is adenosine. We all know very well that adenosine has to be given through a large bore line. Arm has to be elevated, it has to be flushed, because the duration of action of adenosine is just seconds, probably 30 to 40 seconds. So, it has to immediately reach the heart to terminate this tachycardia. A 57-year-old woman presents to the hospital with 2-hour history of retrosternal chest pain and dyspnea. Her electrocardiogram ECG reveals an acute myocardial infarction pattern. Which of the following ECG pattern is consistent with that interpretation? Among this, elevated ST segment clearly depicts the origin of a myocardial infarction here, because acute myocardial infarction patterns can be of ST segment elevation myocardial infarctions or non-ST segment elevations myocardial infarction. In ST segment elevation myocardial infarction, obviously ST segment elevations will be there. In non-ST segment elevation myocardial infarction, we can get two patterns. One pattern could be just plain T wave inversions. Another pattern you can get an ST segment depressions also. To learn more about MI and to have a comprehensive knowledge on cases presenting to you with chest pain, you can download the ECG BnB app both for Android as well as iOS. Tall T wave in ECG occurs. The most appropriate answer would be hyperkalemia. However, in certain cases, hypercalcemia can also have a tall T waves. But for the sake of this question, not to choose a best answer, we can choose hyperkalemia. Individuals with suspected myocardial infarction of 24 hours duration, the serum enzyme estimation of choice would be, the answer is CPK-EMB, because troponins are not given here. So, we have two options to choose from. One is myoglobin and the other is CPK. Myoglobin will get elevated within the first 1 hour, and it will set in within 7 to 8 hours. However, CPK will get elevated after 4 to 7 hours, will peak by 24 hours, and it will fall after 2 to 3 days. That is why this is a wonderful biochemical marker even for reinfarctions. In case you are a person who is interested in ECGs, you can check out our ECG BnB app, which is the easiest way for ECG literacy. This app is available both for Android as well as iOS users. For Android users, you can type the name ECG BnB in the Play Store and download the app. And for iOS users, you can download the Class Plus app and enter the organization code which is shown in the screen. Once you log in, you can find the course ECG Alpha, which is present in the store section at the bottom. In this course, entire ECG content is broken down into levels and sublevels. Each sublevel will contain an explanation video in short and crisp format, followed by class notes for easy revision and practice ECGs to solve and relearn. Apart from that, the striking feature is that all your doubts pertaining to the course content will be personally clarified by myself or from the members of my team through the chat support, which is available 24/7. You can post the ECG doubts which you come across during your day in the chat, and we will try to solve it for you. In case if you are a student, you can get the course at 70% off. If you find these type of dedicated ECG content interesting, you can subscribe to the ECG BnB YouTube channel for regular learning. Thank you, and until next time, it's bye from ECG BnB team.